Hi, I'm Dr. Mencilla Rivera, and we're here to model the precepting of the AB case that we just presented. I have a wonderful team with me of students from different health professionals. You wanna introduce yourselves?
Hi, I'm Maggie. I am from the School of Pharmacy.
Hello, my name is Andrew and I am representing the School of Nursing.
My name is Leah, and I'm representing the School of Social Work.
And my name's Sam, and I'm representing the School of Medicine.
Good. So I will be discussing with them the case, and I will go by all the core competencies as we discussed previously on the previous presentation. Okay, guys, so we all read AB case. This is a very complex case. So let's just take a deep breath and try to figure out what we're going to do. So what do you guys think? What is our vision for AB? We need to make a care plan for her. So what do you think? What do you think when you read the case?
Well, I think patient education is a big issue that we need to address. Patient AB doesn't really seem to understand her disease, her diabetes, and her hypertension as well as she needs to. However, I think that the bigger issue today is her mouth swelling and her mouth pain, and that's really the issue that brought her into the office today.
Definitely. We need to center, right? Like the plan on whatever bothers her the most, and it sounds like it's that. Good job. Anybody else?
Well, I'm also concerned about her obesity and her hypertension. I think, like Andy said, she doesn't really understand her condition, and I think we need to teach her a little more about how important it is to check her blood pressure and her blood sugar and things like that, so she knows what's going on.
Good. Very good. Any other ideas?
I'm, I think, a little concerned about her medications. She's taking several different things, and some prescribed, some over the counter, and I just want to make sure she's fully aware of any interactions those might have. She knows how much to take and when, and if there's any potential side effects from these medications, I want to be sure she's well aware of them.
So we have to tease out what are either like the bad effects, right, adverse effects on the medication, and also who is interacting and what else could she be taking, right, that could be making it worse. Any other?
Absolutely. We've identified a lot of issues already, and she certainly does have a lot of medical issues, but I'm also concerned about what appears to be a lack of social support. She doesn't have insurance now. She doesn't have very stable housing. So I definitely think those are things that we can look at and hopefully help her with too.
Good. Well, it sounds like we have a list of issues to take care of. What do you think about that? Like this list of issues, do I have to do this all? Like I'm the medical doctor for her. So what do you think?
I don't think you need to do it at all. We have a team here of nursing, pharmacy, social work,
Excellent.
and doctors. I think we can all work together to treat this patient.
Right. It will be the best for the patient, right? Like it's almost like impossible that one person takes this on. This is a very complex patient. And again, not everybody needs this, but AB definitely needs that, okay? So now we all discussed, our vision for her, and we sort of like could make a list of, what roles and who can do what. But, in all this, we need other people that are not in the room. So, we're going to have to, call in, it sounds like dental, like you brought in. So we have to, it sounds like have a dental consult and bring them on board and try to all work together and coordinate that. Now for that, what do you think? Can we do all randomly at the same time, or do you think it would be better that maybe somebody or maybe fewer people coordinate all this?
Well, I can work with coordination. I have a long-standing relationship with the patient, so I can coordinate with dental appointments, get those appointments set up, and also coordinate with other services as well and get in contact with social work. And then I can work in about a week time, get back with all of us and kind of update us on where the progress is.
Perfect. Excellent, guys. So like you saw, not all the time you're going to be working with a lot of health professionals in your office, but it is important to make aware the student, whoever you're working with, the advantage and for the patient to bring other people on And if you take one core competence by one core competence, you will not forget all the pieces that are important for the patient to have. We discussed the value and ethics at the beginning. We did this patient-centered care. We had a vision for her. Then we discussed about the different roles and responsibilities that different health professionals can lead. Then we talk, we didn't talk too much, but interprofessional communication is important to get everybody that needs to be on the case on board. When you are modeling and also teaching different students, it is important to remind them that the language that maybe one health professional use is not the same as the other one. So they should avoid to use medical jargon or even name of medications, to try to break it down so the team doesn't feel left out, or if they don't understand, so they don't, so you don't, the communication should be all in the same language. At the same time, you should encourage them that if the other student or health professional is saying something that they don't understand, you should encourage them and say, I'm sorry, I'm not understanding what you're saying. And that way the communication is both ways and there's clarification. And last, the team-based care and work, you encourage them to have different leadership roles, and it makes sense depending on the patient needs that different health professionals take the lead. In this case, the nursing felt more comfortable because they knew the patient well and they need a lot of coordination. But in other cases, might make sense that the medical professional take the lead or the pharmacy take the lead, any other. And you should encourage all the students and maybe take time for each to have the leadership role at different times to help make up the plan for the patient care. So thank you for being with us. And if you have any other questions or discussions, you can go back to the website for PCC Camp.